Hello, my name is John Marmarou and I'm speaking with you today from Providence, Rhode Island. My role as Executive Director is both challenging and rewarding. I'm not able to be there with you today because my role as dad requires me to stay close to home. I'm very excited to celebrate and acknowledge the 10-year anniversary of the Jimmo settlement. This clarification happened in 2013. So much has happened since then. Progress in terms of maintenance therapy continues to move forward. This milestone would not be possible without the work and dedication of those at the Center for Medicare Advocacy. In 2008, I shifted my career to focus on those with chronic illness. The challenges that I saw, what needed to be addressed, was how do we as clinicians safely and effectively maintain gains for our patients after skilled intervention is stopped. In my view, the acute care system was doing what it was designed to do. It was doing a good job of stabilizing people from a medical point of view and getting them home safely. But once this occurred, care stopped for those vulnerable populations. There was nowhere for these people to go safely to remain stable and stay in the community. This was a big problem to me. Patients with chronic illness were often receiving care only when they became very ill. This type of episodic care did not make sense to me, and ultimately I viewed it as wasteful and it discouraged the patient. This was when I decided to start treating patients regardless of insurance restrictions. This was very satisfying, but it was difficult. Then the Jimmo ruling happened, and we were very happy. Of course, one reason we were happy is possibly we would be reimbursed for these very necessary services we've been providing for many years. But more importantly, I was happy because the spirit and the substance of the Jimmo ruling directly aligned with our mission. And it made sense. It's what was best for the patient. This is very encouraging to me. Jimmo was a huge victory for so many, and it's changed many lives. Patients with certain conditions cannot safely and effectively maintain gains, period. If Jimmo is not followed, many could have a negative event that will result in a hospitalization. This is a predictable pattern that I've seen for many years. It's upsetting to me because I know it doesn't have to happen. We have to find a way to improve this. The Jimmo ruling is an amazing achievement that would not be possible without the work of the Center for Medicare Advocacy. To my friends and colleagues, for the sake of our patients, we have to keep our eye on the ball. Rather than tell you how Jimmo has changed lives, I thought it would be better if I showed you. Enjoy and happy anniversary, Jimmo.
I'd been to other physical therapy offices before, and I'd really noticed I'd do my 10 or 20 appointments and then I'd have to wait 6 months to get more appointments, and I would really notice that I would get worse during that time. Whereas when we're coming here consistently, it's much better at maintaining progress. MS is such a unpredictable disease that you can't really compare yourself to where you'd be without it, but I know for sure that I wouldn't be able to still do some things I can do. I use a wheelchair full time, but I can still mostly be independent.
I've been to a lot of inpatient and outpatient PT rehab places, and it's not like here at all. They treat you for whatever's going on. Oh, I have a foot drop, or I sprained my ankle. It's very short term, and it's not looking at the whole person. So this is a very unique model. I've never seen anything like this, where I can go to rehab, have the same therapist. Chris, the director here, has been literally working with me for 6.5 years. You don't have relationships like that with physical therapists in the community.
I had been asking for years to have a physical therapy referral, and no one was really prepared for MS patients. In fact, I had several centers say I couldn't do work there because I had MS. Keeping up with physical activity and a guided program like they offer here is really essential. I think anytime that I've taken a break for reasons of illness or something else going on in my life, I've always had to build back up. But if I maintain, it really keeps me much better.
If I didn't come here, I think I'd be in a wheelchair at this point, and I think I would probably be a lot less mobile and a lot less active than I am. You could be proactive, and I think you have to be proactive, otherwise I think the illness takes its toll. I believe that if I had been limited to 10 sessions or 15 sessions, that I would have just gone straight downhill afterwards.
I honest and truly believe that I would be in a wheelchair if it wasn't for the MS Specialty Center and all the amazing people that work here. I absolutely would be. I'm so thankful to everyone that works here. Even my fellow patients, we all kind of keep each other going. I really think that this is the most amazing place.